If you're a man over 60, you've probably wondered about this question, but felt too uncomfortable to ask your doctor. Today, we're going to talk about what medical research actually says about sexual frequency for men in your age group, and why this matters more for your health than you might realize. I'm going to share findings from urologists, cardiologists, and medical researchers that might surprise you. And by the end of this video, you'll understand exactly why this isn't just about pleasure, it's about preventing serious health problems. But first, let me be clear. Everything I'm sharing today is based on peer-reviewed medical research and recommendations from leading health organizations. This isn't opinion, this is science. So let's dive into what the research actually tells us. A landmark study published in the American Journal of Medicine followed over 31,000 men for 18 years. What they found was groundbreaking. Men who engaged in regular sexual activity, whether with a partner or solo, had significantly better health outcomes across multiple areas. We're talking about reduced risk of prostate cancer, better cardiovascular health, improved sleep quality, and even better cognitive function. But here's what's interesting. The benefits weren't just about frequency, they were about consistency. The Harvard School of Public Health conducted additional research specifically on men over 50. Their findings showed that men who maintained regular sexual activity had a 20% lower risk of developing serious prostate issues compared to those who didn't. Now you might be thinking, how often is regular? And that's exactly what we need to address. According to urological research, the optimal frequency for men over 60 appears to be 2 to 3 times per week. But here's the important part. This includes both partnered activity and solo activity. Dr. Abraham Morgentaler from Harvard Medical School explains that regular ejaculation helps flush out potentially harmful toxins from the prostate gland. Think of it like changing the oil in your car. Regular maintenance prevents bigger problems down the road. A study in the Journal of the American Medical Association found that men who ejaculated 21 or more times per month had a 33% lower risk of developing prostate cancer compared to men who ejaculated 4 to 7 times per month. Now, for men over 60, reaching 21 times per month might seem unrealistic. And that's okay. The research shows that even moderate increases in frequency can provide significant health benefits. The key is consistency rather than hitting a specific number. Let's talk about the specific health benefits that research has documented for men over 60 who maintain regular sexual activity. First, prostate health. The prostate gland produces fluid that's part of semen. Regular ejaculation helps prevent the buildup of potentially carcinogenic substances. Multiple studies have shown this protective effect is most pronounced in older men. Second, cardiovascular benefits. Sexual activity is actually a form of moderate exercise. It increases heart rate, improves circulation, and can help maintain healthy blood pressure. For men over 60, this cardiovascular boost is particularly important. Third, sleep improvement. Research shows that sexual activity triggers the release of hormones like oxytocin and prolactin, which promote deeper, more restorative sleep. Better sleep means better immune function and cognitive health. Fourth, stress reduction. Sexual activity reduces cortisol levels. That's your body's main stress hormone. Chronic stress is linked to everything from heart disease to diabetes, so this benefit can't be overlooked. Fifth, hormone regulation. Regular sexual activity helps maintain healthy testosterone levels, which naturally decline with age. This can help preserve muscle mass, bone density, and energy levels. Now, I know what some of you might be thinking. What if I don't have a partner? Or, what if I'm experiencing difficulties? First, remember that the health benefits apply to solo activity as well as partnered activity. The research doesn't distinguish between the two when it comes to prostate health and other benefits. Second, if you're experiencing erectile dysfunction or other sexual health issues, this is actually more reason to maintain regular activity, not less. Use it or lose it is a real phenomenon when it comes to sexual function. Many men over 60 experience some degree of erectile dysfunction, but that doesn't mean sexual activity has to stop. There are medical treatments available, and even partial function can provide health benefits. The important thing is not to let embarrassment prevent you from maintaining your sexual health. This is as important as exercise, proper nutrition, and regular medical checkups. So what does this mean practically for men over 60? Based on the research, aim for sexual activity 2 to 3 times per week if possible. This could be partnered or solo. Both provide health benefits. If you're currently much less active sexually, don't try to jump to this frequency immediately. Gradually increase over time. Focus on overall sexual health. This includes maintaining good cardiovascular health, managing stress, getting adequate sleep, and eating a diet that supports circulation. Don't ignore sexual health problems. If you're experiencing difficulties, talk to your doctor. There are effective treatments available, and addressing these issues early is always better. Consider this part of your overall health maintenance routine. Just like you might take vitamins or go for walks, sexual health deserves attention too. And remember, this isn't about performance or meeting some arbitrary standard. It's about maintaining your health and quality of life. The research is clear. Regular sexual activity provides significant health benefits for men over 60. We're talking about reduced cancer risk, better heart health, improved sleep, and better overall quality of life. The optimal frequency appears to be 2 to 3 times per week, but the most important factor is consistency rather than hitting a specific number. This isn't just about sexual satisfaction, though that's important too. This is about taking care of your health in a way that many men don't realize is scientifically supported. If you found this information helpful, please subscribe for more evidence-based men's health content. And remember, always consult with your healthcare provider about any concerns related to your sexual health. Your health after 60 doesn't have to decline dramatically. With the right information and approach, you can maintain vitality and wellness for years to come. Thanks for watching, and I'll see you in the next video.